Hi, it's Misty with HealingWithJuices.com. I've been discussing how I have Ehlers-Danlos syndrome, which is a connective tissue disorder that affects the collagen production in the body. That means we have tendons that tend to snap and break. They stretch out, so those tendons and ligaments don't hold our joints in place like they're supposed to be held in place. One of the common questions that I receive from people across social media is, I have joint hypermobility syndrome. Is there a difference between JHS and Ehlers-Danlos syndrome? So to look at the two syndromes individually, some people will say that joint hypermobility syndrome, you don't have like the full systematic involvement that you do with Ehlers-Danlos syndrome. Ehlers-Danlos syndrome not only affects the musculoskeletal system, it also affects every other system in your body. It affects your cardiovascular system. You end up with blood pooling in your legs. It's common to have valve prolapses in your heart, or to have regurgitation, which is a murmur. In that system, it'll cause disruption in your intestinal system, can cause problems with breathing. It also affects your nervous system and how you process various bits of information on a day-to-day basis. So Ehlers-Danlos syndrome can have a host of problems, and each one is looked at by different physicians, and all they're looking at is the system in which they specialize in. So it takes a lot for a person to even be diagnosed with Ehlers-Danlos syndrome. So when you're looking at the Ehlers-Danlos syndrome in comparison to joint hypermobility syndrome, in joint hypermobility syndrome, most physicians see no other involvement. They're not looking at the different systems in the body and how they may or may not be affected. So they look at just the musculoskeletal system. They ask about pain because pain is a huge problem for people with Ehlers-Danlos syndrome. If the pain isn't as substantial as they would expect, then people are diagnosed with joint hypermobility syndrome as opposed to the hypermobile version of Ehlers-Danlos syndrome. But Dr. Graham is a great leader as far in the medical profession. He does quite a few speeches. He does attend conferences covering Ehlers-Danlos syndrome. And he states the debate as to whether joint hypermobility syndrome and Ehlers-Danlos syndrome hypermobility type are one and the same has ranged for 40 years. The tide has now definitely turned in favor of the lumpers against the splitters. So doctors and medical professionals are now placing people that have joint hypermobility syndrome, also known as benign joint hypermobility syndrome, into the same diagnostic classification as the hypermobile Ehlers-Danlos syndrome. He goes on to state that gradually, as incontrovertibly convincing evidence has appeared, it has become obvious that joint hypermobility syndrome and hypermobility Ehlers-Danlos syndrome are either truly identical, or if not identical, at least indistinguishable from one another. So what Dr. Graham is saying there is the two, in essence, are exactly the same. So is joint hypermobility syndrome the same as Ehlers-Danlos syndrome? They could be classified as yes. The answer could be yes, very much so. They definitely, all of the symptoms seem to overlap. It looks as though joint hypermobility syndrome has the potential to have less pain or a more mild version of what people with hypermobile Ehlers-Danlos syndrome seem to experience. I hope that answers your question. Thanks and have a great day.